And in this video, I'm going to show you why we trust only autogenous bone in the modification according to Professor Curie with the split bone technique. Let's look why. And some of you asking us, what are the clinical studies or histological different to the substitutes or solid blocks? Here in this, only this one slide, you will see the different of this techniques. So this was a clinical study which done by Professor Curie, and you can find it in the book 2007 Bone Augmentation in Oral Implantology. And this is a study between different bone grafting techniques. One was the harvesting from the ramus, but as solid standard thick block. This is the yellow one. The other one is from the chin. It's a other structure close to the retromolar. The last one is the biological concept according to Professor Curie. Let's look what did the colleagues in this study. They wanted to know how many is the amount of the vital cells. Here they looked to the osteocytes. In the first concept with solid standard block from the ramus without to split is the yellow color, and you see nearly 30% of the amount is vital cells, osteocytes, nearly only 30%. If you go to the chin and harvest a block from the chin and use it as grafting material, and then after the regeneration you check the number, the amount in a histological way, how many osteocyte in percent you have, you will get between 30 and 40%, nearly 35%, a little bit more. What was the histological view was, if you harvest at biopsy, you will see in the biopsy new regenerated bone, and this surface here with osteocytes are, if you go closer, the red zone on the surface which is building on the osseo formation. So, and this is what was the statistical goal, to see it in the histological view. And if we compare the both with the biological concept, and you will see with the split bone technique and bone chips in the gap, like in our concept, you have more than 60% vital cells. This is 100% more as to the both other or to the standard grafting method. Means if you have 25% in compared to 60 and 60% more, you will see that is more vital cell, more red, more regeneration. And this is the power of the Curie concept, because we increase the vital cells, osteoblasts, osteocytes, which is able to regenerate more, better, and has also a protection against resorption infection. So means also in the long term is what we want to have, a vital area which we can insert our implant, not in a death material like substitutes or other alternatives to the gold standard autogenous bone in the modification with the split bone technique according to Professor Curie. I hope you could understand from the histological view how is the vital concept of bone augmentation, and this is the reason why I and our students are trust only autogenous bone. We are also not mixing with biomaterials. You can gain the area if you follow our protocol. After the harvesting with the splitting and thinning process, you have enough particle bone chips to fill the gaps that your implant is not in a solid death white bone or in a thick cortical chin bone. No, it's in pure particulate bone chips, which is similar to the rich consistence, or through the compression in the most of the case better as the normal bone, because the normal bone is trabecular, has some gaps, but with the compression you fill and condense the bone around the implant during the augmentation, so that your implants are more safer and your regeneration is more predictable. I hope this video could help you. See you in the next video. Your Serif.